Okay, so we are going to go ahead and start. Welcome everybody to our third webinar in our Start the Conversation series. But before we start, I just really want to mention that as we're talking about suicide prevention, you know, we know that these conversations can be triggering. So if you're having thoughts of suicide and you want to talk to somebody, please reach out to the National Suicide Prevention Lifeline number at 1-800-273-8255. Or you can contact the crisis text line and text 741-741. And in both cases, a crisis counselor will reach out to you and talk or text with you. We also have many resources on our website at www.suicidepreventionalliance.org. So I want to welcome our fantastic advocates that we have today. So, and for those who are watching this live or are going to be watching it later, thanks for following us. So today's webinar is, we're talking to suicide prevention advocates. So myself, I personally have a high standard of what an advocate is, especially in suicide prevention, because that's something I'm very passionate about. And along with these 4 people today, I know that they're passionate about. I learn from these people every day. These are people in the field who just don't talk the talk, but they do the many little things that need to be done every day to save lives from suicide. These people are out and about spreading awareness, being proactive, and doing the unique things in the community, such as listening to those who are having thoughts of suicide, those who are lost survivors, those who've been impacted by suicide in some way. To me, an advocate is someone who just doesn't talk about change, they create change. So today we have 4 very special people who do just that. So if you have any questions for them, please go to the chat section and write them down, and we'll try to get to your questions during the webinar. So I want to thank Kathy Wallace, Mary Brown, Hunter Robbins, and Anna Trout for coming today. These are amazing people who I look up to in the field and learn from all the time. So I'm going to start with Kathy. So Kathy, if you just introduce yourself and tell us where you work at and give us a brief bio about yourself.
Kathy Wallace, and I'm from Northeast PA in the Scranton area. And I volunteer at an organization that has all volunteers, and that's Northeast Suicide Prevention Initiative. And although we're primarily located in Lackawanna County, if called upon, you know, there's no boundaries to where we go or what we do. And so that's it. My background is in children's mental health and then adult mental health as a clinical person. So I don't know if you want more than that. That's it.
Nope, that's just fine. I can tell you that even with her brief bio, what she talks about, she does so much more to help out.
I try.
Not only try, you do.
Yeah.
So thanks for coming aboard. Hunter Robbins.
Thank you for having me, Govan. My name is Hunter Robbins. I am the Suicide Prevention Coordinator for the Department of Behavioral Health and Intellectual Disabilities for the City of Philadelphia. My background is in mental health and behavioral health. I was a crisis worker. I was also a case manager. And then I was a community liaison, and I worked closely with Anna Trout as well. And I think a lot of my work now is a different look at suicide in terms of, you know, looking at it as a public health issue and looking at it as a systems issue. There's still advocacy, there's still awareness that all goes into that. But it kind of sheds a new way to look at suicide and presents a new challenge. So I'm happy to be here and happy to talk about it.
Thanks, Hunter. Next, we'll go to Anna Trout.
Thank you. So I'm from the Montgomery County Office of Mental Health, and I oversee the crisis and diversion programs that we do there. And a lot of that work entails not just work with contracted providers and formal services, But probably the best part is helping to coordinate our suicide prevention task force, which is a diverse community group of people who are, the one thing they all have in common is that they're advocates, and then everything else is a little bit different. And that's part of what I think makes it great. By education, I'm a social worker, and that's my background and sort of what I come to it with. And it's just been a real honor to get to work with a lot of the people who are on this webinar today. I'm excited to get to meet Kathy, because I don't think we've met before, and sort of share the ideas of how we just keep doing right by people and keep supporting our communities in meaningful ways. So thank you.
Thanks, Anna. And last but not least, Mary Brown.
Thanks, Kevin. Well, I am currently the coordinator for the Clearfield Jefferson Suicide Prevention Team. Been doing it now, hitting close to 13, 14 years that I've been there. But my paying job is I work for the MHIDD EI program for Clearfield Jefferson counties, and I've been there for over 20 years. I think I sound like a broken record here that I also did crisis. I was actually the delegate supervisor for our 2-county area. I just kind of handed over that position because I got a promotion. So now I just oversee her position, and now working more with both sides of the house. MH and IDD as a complex case coordinator. That's a mouthful. Been learning a lot about IDD and autism and you know, those individuals, to try to work and try to figure out how do we help someone with that are dual diagnosed. So it's been a little bit challenging, being that now the pandemic, I came in with new position in the middle of a pandemic. So getting to learn everything, see everything through Zoom, it's been interesting. But you know, I have been my coordinator, and my boss at the county program has allowed me to basically be that coordinator as long as it didn't interfere with my job. So, you know, I put a lot of time as coordinator, and it's, as Govan said earlier, a lot of evenings go into being the coordinator for that position. So, and I came up through the ranks. I was case manager. I did CASP, Children's Adolescent Services and Program Coordinator. And then I was the crisis program specialist. And then now I'm the complex case coordinator. So, you know, very slowly worked my way up in the program. But I think my biggest claim to fame is that coordinator, and, you know, being able to get that awareness out there, give the trainings. You know, I've done lots and lots of trainings. I've done trainings with Govan, you know, anywhere across the state. But, you know, I'm very proud that I've been able to train many, many individuals just in my 2-county area. So thank you.
Thanks, Mary. So Hunter, we'll start with you. So tell us, you know, how you got in this field of, you know, suicide prevention. And, you know, all of you, as I kind of was doing the intro, you just don't kind of just get involved in suicide prevention and just work 8 to 4. Each of you do go above and beyond in your advocacy. So tell us, you know, how you got involved and why you do this, because this is not an easy field to actually create change.
Yeah, definitely. I guess that's something that's a big thing for especially Kathy, and I think everyone on this call, is that we typically don't brag about ourselves. And that's something that we don't do because we just love the work that we do and we're passionate about it. I would say, as Dr. Campbell, if you're familiar with Dr. Campbell and what he says, I crawled into it. So I was actually in residence life before this. I was working at a college, and the opportunity just didn't seem there, but I was getting my master's in counseling. So I ended up transitioning and getting a job as a crisis worker, and I just immediately fell in love with it. And it was challenging, it was exciting, but I think what really grabbed me was one day when I was on the job. It was a few days into the job, and we get out of the car and we're going into what was called Montgomery County Emergency Services. And it's a hospital for inpatient in Montgomery County. And a lot of times, a lot of individuals who are going on involuntary commitment end up going there. And I turn around out of the car and I look at this building and I go, oh my God, I've been here before. And I couldn't put it where it was, but it really turned out it was, as I'm walking into the building, I'm going through the metal detectors, I'm remembering myself as a 7-8-year-old going through the same metal detectors. And I remembered I had toy cars in my pocket and the metal detectors went off, and they allowed me to bring the toy cars in because I was going to see my mom, who was under involuntary commitment in the same hospital. So right then I was like, this is where I belong. And it just built from there. So my family had a long history of psychiatric emergencies and mental health disorders and addiction. And it kind of just drove me to be more passionate about the field and learn more. And then as I started to work with individuals, I found this problem of suicide to be so unique and so troublesome because it affected not only myself and my family, but it affects so many individuals, and it feels like there isn't enough support out there. So I really just leaned into it. And I just wanted to create a better community, a suicide safer community, and educate individuals, because what we need to be doing is talking more about this and not being afraid of it and not shying away from it. And we really have to at times lean into this conversation so that we can get people the support they need. So I feel excited and happy when I get to break down barriers. I get frustrated at those same barriers, but at the same time, it ignites me to find ways around them and find new creative ways to be able to bring this topic to the forefront and be able to address it. So that's kind of where my passion and how I got into this.
Thanks, Hunter. I'm always going to be amazed at everybody's story, and I'm learning about each of you today. So I'm excited to hear, why you got into this, and what, later on we'll find out a lot of the different unique things that you do. Anna, so please tell us about, why and how you became a suicide prevention advocate and why this field means a lot to you.
Sure. So I think becoming a suicide prevention advocate is something that sort of grew out of being a social worker and being interested in mental health and mental wellness. And that was a field that it took a long time to be able to put words to why I felt drawn to it. And, looking back now, I'm like, well, of course, because someone I loved very much had a very hard time. And there was a lot of sadness and a lot of trauma there, but there was also hope in seeing things that were helpful and seeing things that did work. And the thing that actually made the connection, at least to get into social work, I wish it was a deep and meaningful story, but it was actually, I was in Spanish freshman year of college, and the nicest person I'd ever met in the whole world, just somebody who sort of like glowed with friendliness, was talking about how she wanted to study social work, and it just wormed its way into my brain. And when I was trying to think about what I wanted to do, I kept thinking, if I could be more like her, she's so nice. And that changed the course of my life. So I ended up going to school for social work, and then various jobs that always kept coming back to mental health. And I met my current supervisor, whose philosophy is, if it's the right thing to do, we're going to find a way to do it. And so I ended up sticking with her as a mentor and coming back to work for her. And one of the projects that she has talked about was, that we really need to support the suicide prevention work in our county. And I think I didn't become what I would call an advocate until three things really integrated for me. And that was the experience of meeting loss survivors and hearing their stories and seeing the grief and the power, right? Two things can be true at the same time. You can be sad and you can be strong, and like having an understanding of that. Meeting attempt survivors and really kind of getting this idea of it's not just about preventing suicide, it's about building a world worth living in, right? Like that might be even bigger. It's something worth waking up for, and all the social determinants of health that go into it. And then the third piece was getting honest with myself and really sort of integrating and acknowledging how personal it really is, right? The experiences after having a baby, with that sadness that rolls in and those dark thoughts that roll in that sometimes you don't put the words to, because even though you're in this field, it still feels hard to be open and honest about that, or thinking about times in your life that, see, even then, like there's distancing of language, times in my life of knowing people who were hurting or who were struggling and how they might have said it and how I might not have at the time had the language or the perception to understand what was going on. So when those three things kind of came together, that suicide prevention work isn't outside work. This is internal work. And this is something that I've experienced, the people I love have experienced. And the voices of people who have lost people are incredible and important. And people who are attempt survivors, we need to not just hear them, but make sure there's space for them to be the leaders of the work that we're doing. When those three things clicked into place, I think that's when I sort of crossed over the line from doing a job to being an advocate.
Wow. Thanks for sharing that, Anne. That's pretty powerful. Mary. So yeah, if you could tell us, why and how you became an advocate for suicide prevention.
Well, I can tell you a little bit of how first. It was many years ago, before I was a coordinator of our team. I had gone to a conference in Harrisburg, and it was on youth suicide prevention. And during that, I was sitting there thinking, and I think that was actually before I even became the delegate supervisor in the crisis program, that, hearing about young people taking their lives was traumatic enough, but I'm like, I have to do something about this. And I'm like, I got to take this back to my counties. I got to be working with someone at the county level and say, I know this is happening in our 2 counties, so we need to do something about it. So I actually had reached out to our county program director, and she and I sat down and discussed, okay, what do we need to do next? What's our next step? And we thought, okay, well, we need stakeholders. So who do we send a letter to? This was back before email. Can you think of that? Back before email, and we sent letters out to law enforcement, to churches, to EMS, mental health providers, to hospitals. And we got a really good response. And I was kind of surprised. We had like 30, 35 people at that meeting. And it was very, very evident that there was interest in suicide prevention in my 2 county areas. And I'm like, okay, where do we go from here? And we talked about, well, maybe we need to bring speakers in and get the community involved and get the word out that there is this problem and we need to start doing something about it. I didn't even think about, should I talk with other counties who already have something? Didn't even think of that, which right now I tell people, talk to someone who's already doing it. So, we didn't even think of doing that. We just kind of took the plunge and started working on, okay, we got this team. How often we're going to meet? What are our goals? What do we want to do with this core group of people? So, and it was a process. It took us probably a year or two to kind of finalize everything. But I think when it really came to fruition that advocacy was kind of where I wanted to be is when we finally were able to do our first walk. And it was amazing that there was like 400 or 500 people that came to our first walk. So that told me, there are so many people out there that are affected by suicide. And this is just my 2 counties. And I was amazed that, and people got to meet other people. This was kind of like the beginning of a wonderful experience that I could see, survivors talking to survivors. And if they were attempt survivors, they got to meet other folks living that same experience. So I think that was kind of where it finally hit me that this is what I need to continue to do. So that was, I don't even remember what year that was that we did our first walk. And it's kind of grown ever since, our walk. We have a great walk. And this year, of course, last year was horrible because we did virtual. We're never going to do virtual again. We promised ourselves we need to get back to that face-to-face because it's so much more important to do the one-on-one, to be able to talk to someone and hear their stories. It was just great. And every year it's the same thing. We have a great walk every year. So that's kind of, where I'm at with advocacy. And it's probably, I'll be here till, I can't do it anymore. But that's my story.
Thanks, Mary. And I can say that, I met you, back in the mid 2000s, and we started working on suicide prevention stuff with the state and the state committees way back when. So, so you were heavily immersed in that, and glad to have you. So now we turn to Kathy Wallace.
Okay.
There's a lot of great things up in the Northeast.
My story is very similar to what Anna said. How I started may be a little different. I was working as I was working as a clinician, And then I was a coordinator of children's mental health services in 3 counties, and got to meet some great people. And then I went to children's mental health advocacy, because children's mental health system is very complex. A lot of services, a lot of how to get those services. And so I was doing some advocacy, and I was contacted by someone who lost their sister to suicide. And through what we did a program, and she raised a lot of money, and just working with her, we became friends. And like Anna said, it's the people that you meet that keeps you in this. And so at the same time, I started learning more about suicide prevention, because a lot of people don't know that as a therapist, you don't get a lot of training in suicide prevention. And that's an understatement, but, and that's an advocacy issue. But
Absolutely.
but one of the things that happened is that Pennsylvania got a Garrett Lee Smith grant for working with primary care doctors doing a web-based screening for young people from 14 to 24 years old. And what this, it was in Lackawanna, Luzerne, and Schuylkill counties. And so each county had a coordinator. I ended up being the coordinator for 2 counties. But what the project was is doing a screening by computer, and it would spit out a response and give it to your primary care doctor when you were right before you went into their office. And so through that, through that grant, I started meeting people that were very knowledgeable about suicide prevention. Not loss survivors yet, but I was so fortunate in being able to go to a lot of wonderful trainings and learned a little bit more and a little bit more. And like Hunter said, it just sucks you in almost, because there's not a lot of people doing it. There's not a lot of information out there. And so little by little, I learned a little bit more, met more people, and then started finding out what we didn't have in our area. And that turned out to be a loss survivor support group. And so I started that, and that went on for years. And I can't say enough about that. In fact, I think there should be a law that every clinician has to attend a loss survivor support group, whether you're going to go into suicide prevention or not, because those are the people that you learn from. It's not really a textbook. It's the people who've gone through it, and attempt survivors. I'm so fortunate in that I know some wonderful attempt survivors, and you keep hearing about those myths and comments, and you want to educate the world, but we'll do it one county at a time, huh, team? So that's how I got into it, and I stayed into it because of the people that I've met are just absolutely wonderful. Then when I lost my job, I got to spend more time, full time, and now I'm retired, so I get to spend a lot more time and not have to worry about a job, a paying job. And there, in our area, there is no suicide prevention monies set aside for suicide prevention. And so we'll talk about that later, but that's how I got into it, and that's why I'm still here.
Well, I want to clarify something. You might be retired from one job, but doing the work, you are not retired from doing a lot.
Okay, let me clarify. I'm retired from a paying job.
Okay. There you go. Okay. So thank you, everybody. You know, your stories are so impactful, in that each of you do so many special things, and the work with loss survivors and attempt survivors is so important in this field, and the empathy that you show them, you know, is so needed. And, I wish that I could clone each one of you to, be out not just in Pennsylvania, but across the country, across the world, because we need people like you. So, and I'm going to go to you for the next question. So, what are some of your successes that you've had in your advocacy? And conversely, though, what's been the most difficult? So, I'll let you take it from there.
I think probably the biggest success, or at least the one that I would say I feel the most excited about, is what our task force has become, which is really this incubator for ideas, and then this support network launch pad for people to come who want to do things in the community, but aren't sure where to start, aren't sure how to pull down resources. They may not be familiar with some of the bureaucracy that goes on behind the scenes to get things going. And so that's a place where it's welcoming. Who are you? Someone that's interested in doing this? Good. Then you're welcome, and your ideas are important, and we need you here. And then, by profession now, I'm a bureaucrat. So I'm like, I'll be there. I'm the bureaucrat that'll be there, and we'll help take the notes, and we'll schedule the meeting, and we'll connect you to the right people, and we'll make copies if you need it, or we will fight for a grant if you need it. But you just come with your ideas and your passion, and let the task force kind of build up around that and help make it happen. And so the best projects are coming from folks who are teachers, law enforcement, family members, attempt survivors themselves. Those are the most meaningful interventions that the task force has been able to churn out over time. And, I think there's so much value to the clinical mental health world, but they're not the ones showing up at the table saying, it's my son, it's my neighbor that I do this for, it's myself that I do this for. I have to make a difference. And so we're like, all right, come on down. We'll help you figure that out. I think that's probably been, from an advocacy standpoint, the biggest deal, is making it something that empowers the community to change things. As far as what has been the most challenging or the most difficult, I think the work to make policy match what we know works is really hard and has been really challenging. The things that we know make the biggest impact in suicide prevention are things like time, having time to sit and have a conversation with someone, peer support, welcoming spaces, the social determinants of health, having enough food to eat, having enough money in your bank account, having a home to go home to, easy peasy access to services. Who's your funder? What's the wait time? Are there slots? As long as those are questions that are having to be asked, services aren't easy to access. And then the one that can sometimes feel controversial to say, but a certain comfort level with risk, being able to sit in a space of risk and patiently listen to a person's story and validate them, and maybe not press the red flag button right away. But there's a lot of concern about that. And there are a lot of policies, especially internal to mental health provider agencies, that are written sort of contra to what we know is most helpful. And that's, not a dig at our agencies. That's just a reflection of where expectations are, right now, and sort of an understanding of what do I do? What's the next best thing for me to do to be helpful to someone? And it's not always clear. So I think that's probably been the most challenging, is we want to be radically supportive and validating. Not everything's ready to be radical yet. And what do you do about that? And how do you not cause more harm as you're trying to do good?
Well, I think, you really succinctly put it really best. And the fact is, it is time to sit down with people. It is listening. And it's not just telling people, call the lifeline or the crisis, or contact the crisis text line. That we know that listening to people is probably one of the hardest things that we have to do. And it's giving of your time. But more importantly is that we know that by the simple act of listening, that saved lives. That's the difference. And people will get more out of that than giving them a resource right away. So thank you. That's just a huge point there. And I know all of you do that in abundance. So Mary. So what are your successes and that you've done and who you worked with? And conversely, again, what are the difficulties in this field that we need to change?
Okay. Well, I think, I said this earlier, but I think my biggest success was launching that team for our two-county area. And it's been going on now for 13 years. And I think that's a great success that I can take with me wherever I go. And I definitely, another success that I see that I do have other counties that will reach out to me and want, you know, let's not reinvent the wheel. Let me help you to start your own task force, or how to get a walk going, because I've done a walk for many, many years. And that can be quite difficult if you don't have a good planning group to do it, is how to do that. So, I mean, I think that's one of my biggest successes, is because other people come to me for information. How did you do this? How did you make it work? What were your problems that you had dealing with it? You know, I think I've been there, done it with just about everything you can think of with our task force with suicide prevention in our two-county area. You know, I've trained a lot of our other people on our team to be QPR trainers. I'm a master trainer myself, and I've trained, like I said before, thousands of people in my two counties. I'd love to train more, but there's only one of me. So that's why I train more of my group. So I'm up to, I think we've got 5 now. So it's not just up to me anymore. Like I expanded that knowledge to other folks on my team, so they can go out and kind of get more and more people trained, because we know the more that are trained, the more we're going to help save lives. So that's a big goal that, you know, our team has tried to do, to get that training going. I also do the assist training and go in. I've done it for how many years now. So there's those people who now have a much better understanding of how to help someone too. I guess I do a lot of trainings, and it's kind of one of the biggest things I do. And yes, I get to hear a lot of those stories afterwards. I get to hear those that, you know, my friend was talking to me like this, and now I know how to better help that person. So that's always great to hear, you know, you're validated that you now made a difference for someone. And that always keeps me going. Some of the more, you know, I guess the difficulties, and one of the ones I'm dealing with right now is that survivor of loss support group. Like we've been having one for many years now, and it's how do we keep it going, because we may have 1 or 2 people attend. What are we missing? Because we know in our 2 counties, we have suicides. We just had 2 in the past 2 weeks. How do we get the word out? You know, we've been doing this now for a very long time. I've got a great leader who does it. How do we make that connection? It's like, that's something that I've been working really hard to figure out. Is how do we make the connection? How do we let people know, here's all these services we have. Where are we not getting the word out to our community? It's like, I mean, I'm more than happy to take any kind of recommendations, suggestions, bring it back to my group, and, you know, let's find out what's going on. We have the technology, as you know, some of the people might say, we have the technology. You got Facebook, you've got, you know, Instagram, you got Twitter, you got our website. What do we need to do? You know, that's my big question now with that support group, is what do we need to do? We want to help our people. So I just see that something needs to, I don't know, somewhere click. That's where's the disconnect. There you go.
Okay, thanks, Mary. And I think you're being modest. You're talking about the successes that you've been, again, working in suicide prevention, at least in state committees too. So your range is broad, not just your 2 county area. So
yeah, well, and I guess the other thing too, I guess one of my successes is I do have this nice list of task forces. So whenever we need to reach out, I have this great list that if there's something new and what's going on in the state level and I can share it, I'm more than happy to share it with that list of all the task forces, which keeps growing. we have a lot now from the VA. So we've got, and they're becoming a big part of that task force group. So yeah, I think I'm like the keeper of that book, as you could say, of the task forces across the state.
Thanks. And yeah, I think task forces is such an essential piece to the puzzle in getting connected with the community. And each of you have done that. So, Kathy, you're next. So tell us some of your successes, and conversely, what are the difficulties in your area in the Northeast?
I really think my successes is networking. And now I know Anna, so she's on my list now too. One of the things that I really want to say about success in advocacy is everybody on this webinar comes from a clinical background or a systems background, and you don't have to. You could absolutely be someone who just has an interest, someone who's lost someone who's attempted. And so I really want to get that message out in this webinar is advocacy is not that you come to the table with all this knowledge. And so once again, I think my successes is that I'm very curious and I want to keep learning. And so the networking that started probably with the Garrett Lee Smith grant, and building on that, we have recently, since December, we finally got a task force, we call it an alliance, in Lackawanna County that I've been begging for years. And it's just never happened. And so with our organization, it's all volunteers and they come and they go. And I think that with suicide prevention, when someone loses someone, they'll say, oh, I want to volunteer with your organization. But it's not that we have something every week for someone to do. And so I think that it just kind of drops off. We have a lot of volunteers for our walk, Mary, and I'm sure you do, but other times of the year, most people have full-time jobs. So it's myself and another, Mike Nelson, who's our president right now, that could go and talk to the commissioners or go to meetings during the day. But the frustration I feel is that there's not enough volunteers. And I understand that. And this may say something not so pleasant about my character, but one of the most difficult things is listening to other people's ideas that I don't agree with. And that's really hard, like getting, and Govan knows what I'm talking about, getting a first responder focus group to understand that you should have first responders on that focus group. And I have to step back sometimes. And maybe the last couple months more than I usually have to step back. And that's kind of frustrating. So the difficulty is my frustration level, I guess, with things not happening. And so in that, my success is built upon your successes. I could remember when I first heard Hunter talk at a conference, and I was just blown away by your knowledge. I really was. And I'm so happy to see you on this webinar because I might need to call you someday. So I want you to remember this face. And that's really where the successes are. You don't have to know everything, but if you know who to call that might know something, that's really a success right there. So I'm done.
And as you said, networking is huge in this field, and that continuing to learn from each other is essential. If we're going to enact change and make change, we have to learn from one another and what works, what doesn't work. And all of you, which is great, obviously know what does work, but we're continuing to find out nuances that makes it better. So thanks, Kathy.
Thank you.
And Hunter, so tell us, I think you're the young buck in this group here. Although, all of us are young. So tell us what your successes are in your capacity, and then what are the difficulties that come along with that?
Yeah, Kathy, first off, call me anytime you want. You can always reach out to me. I think I would have to double down on what Kathy said. Networking, in the short amount of time that I've been doing this, I've been lucky enough to be involved in some very awesome circles. And I think that really is a large success of, taking every meeting that you can, putting yourself in every position that you can. And this was something that we talked about before we started this whole thing. We were kind of discussing is we never say no to anything. Being an advocate or being awareness and trying to spread this topic is something where you have to take every opportunity that you possibly can. So I think my networking has been something, just like Kathy said, that's been a huge success. I've been lucky enough to do a lot of fun things. For one, I think the last International Suicide Awareness Day in September last year, I got the Eagles Stadium to turn purple for suicide awareness, which I'm a huge Eagles fan, so that's a massive thing that was super exciting to me. But at the same time, I think one of my most important successes that after I did a QPR, or after I did a training, and I went back to the organization and I got to hear stories of people who actually utilized the training and saved someone's life or intervened. Those are probably the biggest successes, because it's hard to see our impact, especially with this work. We try to put programs in place, we try to put trainings in place, and we always hear the bad stuff. We always hear when our communities are struggling, we always hear about new deaths, we always hear about when things happen, but we don't ever really get to hear, these people from your training went out and they saved X amount of people. And that's something that we don't get to actually hear often. So when we do, I think that's probably my favorite success of the whole time. For challenges, to kind of just back off of what everyone said, overall for me is culture change. I think culture change is probably one of the most significant challenges that I have to face in the work that we do, which is going into a place and facing maybe misinformation, myths, or facing people who are scared, who feel like their liability is on the line here when they may lose someone, or if they start talking about this, what's going to happen? And then also culture change can stop fundraising. It can stop resources. It can stop people from saying, yes, I want to get involved here. So I think a big thing is just, having to go into meetings, and when you're told no. Kathy, I understand that frustration, that feeling of I just want to yell and just get all this out and say this is what we should be doing. You want to shake people by the shoulders and say, this is what you want to do, but you can't. So I think a big challenge is that culture change, and being able to sit back and wait and know that a no is just a no for now. It's not a no forever. And then constantly just pushing on that until you get that no to turn into a yes. But I don't deal well with frustration. So I understand Kathy 100% on that one.
Well, the best part is that's why we have each other to talk to, because we can talk about and understand those frustrations that go along in this field. And I think it just makes us stronger individuals, that when we are faced with one obstacle, that we overcome those obstacles by working together, because there is no, person that can do all this by themselves. And, as I'll tell our audience again, these are great individuals, but by working together, we can cause and create change. So, Mary, I'll start with you. So in the field of suicide, we know suicide prevention, we need to work on the aspect of prevention and postvention to try and save more lives. Not only in your area, but all over. What do you think we need to do in those fields of trying to create change?
Well, and I've got some lofty hopes that with prevention, we need to be able to get into all the schools, all businesses, the churches, wherever there's people that congregate. There needs to be a training built into every system we have. We know that the pushback from the schools is they don't have time. Well, they need to make time. I mean, I know there's programs out there that suicide prevention education is built into it. Like our team, we got the Hope Squad is coming into our area. And that's a nice little group where it's in the school. They have their own group of kids that are those that look out for the other kids. You know, they're trained to recognize the signs and symptoms. So we need every school to have some kind of suicide prevention program, and it has to be for everybody in that school, not only the kids, but the staff, you know, the faculty, everybody. And that's just a start. And colleges, all businesses. Like I said, I got lofty hopes that everybody needs to have some kind of knowledge of how to help someone who may be struggling. And I think that's where we need to start. And on the postvention, and you know, we've talked about the lost team, I think, and 988 number is coming. So why don't we, you know, make some kind of connection? 988 should know where all those resources are in that specific area. And I think every area should have a lost team too. Like I said, I got lofty hopes, but
Before you go on, can you tell people what a lost team is?
Sure. Lost team, it stands for Local Outreach to Suicide Survivors. And what that lost team does is after a suicide, they would be called out to meet with that family and talk to them about, here's our resources. And typically someone of that lost team is a survivor. So they can talk to, okay, I went through the same thing. Here's how we can help to help that family to be able to make those connections, to, you know, get the resources they need, to be able to talk to someone. So it's not that continued trauma. So I think 988's coming. Let's make some kind of connection there with 988 where they can now, all right, 988, someone calls in, they just had a suicide in their family. How can you help me? 98, here's our lost team. We're going to send that lost team out right now to help you. So that's my lofty dreams. They may not happen. And first of all, we need more money. You know, there's always room for more money to help put this together. Always. So those are my lofty dreams for prevention and postvention.
Thanks, Mayor. Hunter, what do you think? What do we need to do, you know, in the fields of prevention and postvention, and anything else that we need to do in suicide prevention? Because, you know, one area, you know, we can focus on one area, but then there's other areas that need attention too. So what are your thoughts?
We know suicide is multifactorial, so we know the solution has to be multifactorial. So there is probably an endless list of things that we could possibly do, right? A lot of times we tend to look at suicide prevention in two fields, that clinical versus that community side, and what are we doing in both? And both has different solutions and different research and different evidence-based practices. I would say one of the biggest things that I think could be a simple solution that could create massive amounts of change is getting our clinicians who are going through LPC programs, who are going through MSW programs, to be actually trained around suicide, so that when they get into the field, they're prepared, they're ready, and they're comfortable, instead of us retroactively trying to get people to where they're supposed to be at for what they should already be prepared to handle when going into the field. I mean, we talk about our clinicians being ready and our communities being ready to handle this, but when we look at our systems overall, there's not a single point in the system that's built in to prepare clinicians to handle suicide. Some colleges do it better than others, but it's not something that's standard practice. It's not involving accreditation for many colleges, and that has to change. And what we could see is a massive shift in our workforce that goes into behavioral health and goes elsewhere. How many times have we worked in behavioral health and we know people who started as social workers and end up going into human resources or end up going into the private sector? You start with a low impact cost of training these individuals in these programs, and you could see a great change spread over a large amount of areas. So I think that that's something that we could do and create and do that. And it could be, I mean, it's going to cost something, but it's something that can be done now. For postvention, I think we need more connection. I think we have to realize, we have to recognize the gaps that we have in our systems. We have the gaps between when people leave hospitals, when people have individuals who die by suicide, and now they're survivors of suicide. Where are we providing connection in our system? Just because you're a bystander to a mental health crisis doesn't mean that you don't deserve resources or support as well. I think that's what's something that's really great about some of our crisis teams in Pennsylvania, is that not only do they provide support to the individual in crisis, but they provide support to the family around that person. Because the truth is, there's no such thing as an isolated crisis, right? People, when they have their crises, are typically involved with other individuals around them, and that crisis then affects those people as well. So we have to be cognizant to say, like, all right, we have to provide connection to these individuals, and then we have to be prepared to provide connection to all the people around that individual, whether they're still here with us or not, and make sure that that resource is good, it's long-term, it can follow those people for a certain amount of period of time. And then also dispel the myth that, you know, suicide loss is like any other grief process, because it's not. If you've ever sat and talked to a suicide loss survivor, you'll know that it is completely unlike a normal grief process, and it takes so much longer, and it's so much more difficult to process and to get through, because often you're left without answers, you're left with more questions, you're left with this feeling of guilt and shame or anger, and there's all of these things that are unresolved that take at times years to process and to work through. And if we don't have support for that in our community, or we don't have an understanding of what that looks like, these people then struggle and their own suicide risk increases over time. So it's important for us to make sure that we have that available as well for postvention. And then, you know, I could probably talk for 4 more days about all the other things that we could do as well.
Yeah, thanks, Hunter. I'm amazed by, you know, all your passion so far, and everybody's. So this is fantastic. Kathy, what do you think? So what do we need to do for prevention and postvention and anything else that in the field of suicide prevention to cause and create change?
I absolutely agree with Hunter, is it has to go right from the beginning with training, not only to work with people who may be suicidal or families, but you can't, it's your neighbors, it's your child's teacher, it's everyone. But there are no courses that I know of that are on suicidology. There's a smidgen here and a smidgen there. And for those people that are in the field for a long time, they got even less. And because we're learning more and more constantly about suicide prevention and supporting people who've lost someone to suicide, which is suicide prevention also, we need to keep current. And that's where you really need to get people interested when they're learning about mental health and mental wellness. And colleges and universities they're not a part of our task force. I don't know if they come to anyone else's, but that's a big gap. And what Mary said about, you know, schools, it's not just schools, it's clinical agencies. We don't have time. We can't free up someone to go to trainings. And so we know better, we just don't do better. I hate to say legislation, but sometimes that's the only thing that changes some things. In Zero Suicide, for those of you who don't know, it's a fantastic resource, and it's a listserv, and it hits on so many different resources and topics that you could put something in, but a lot of people don't know about Zero Suicide. So there has to be definitely more education for our churches. Right now, we can't get a faith leader to join our task force. Yeah, I saw your neck go back, and that's absolutely true. We did a training for faith leaders a couple years ago, and it was like pulling teeth getting them to come to the training. And where do people go when they're upset about a family member or they're having problems? A lot of people go to their faith leaders. So sending the secretary of the church to a training, it's not that it's not important, but it's not our focus, what it should be. Dedicated funding is just so needed. And I was thinking of this the other day. Could you imagine like attacking cancer with volunteers? You know, you have to have funding. And when we talk about suicide, we frequently, for older people, talk about how cancer used to be talked about. It wasn't, or it was whispered. And it takes families and advocacy, and sometimes legislation to get funding. And so our legislators are a big part of suicide prevention. They have to be interested in it. They have to understand how it's affecting people. And we are talking about suicide more. So, and that's a wonderful thing, but it just the tip of the iceberg, I guess, right now. Postvention is the same thing. There's that little window of opportunity after someone ends their life that people are, oh, we want to learn more, we want to do more. The workplace may say, can you come in and talk to staff? They're, so upset, but if it doesn't happen right after it, it just doesn't happen. And so a lot of education needs to be done, and meet people where they're at, where they're ready to understand, I guess, and then give them a little bit of resources or support so they could take the torch and go on. So definitely colleges, communities, churches, definitely schools. There's just so much, isn't there? There's so much. It's just, it's overwhelming sometimes.
Absolutely. And I know that I took a huge takeaway in that from what you just told us is about, we need to really focus on destigmatizing the word suicide, because, as many resources that are out there, that a lot aren't being used. And, I'm a loss survivor of 41 years when my brother Michael died. And there was nothing back then, but there's a lot now, but the suicide stats continue to rise. And so what is a disconnect? Why aren't people going to these resources? So if suicide stats are rising and resources and training are rising, there's something wrong there. So it's going to be people like all of us here that are going to be able to cause and create change and destigmatize just one simple word, suicide. And unless we do that, the rates will continue to rise. So thanks, Kathy. And Anna, so what do we need to do for prevention, postvention, and other items?
Yeah, there's been such good ideas shared so far. The two for prevention that are rattling around in my brain really loudly are back to that idea of, I think the field needs to get more insistent and more loud that everything is suicide prevention. Everything, right? Like when your local area is planning or doing inventory of affordable housing options, when you're looking at transportation lines, can people get to each other? Can people get to where they need to be? When we're looking at things like, how much does it cost to live here? Do people have access to enough food to eat? That's suicide prevention. And, so if a politician or a lawmaker they're coming to you and they're saying, hey, what are you doing for Suicide Prevention Month? How did you vote on this last thing that has an impact on our community and their ability to have a good life, right? So I think there's the opportunity to be more bold in making some of those connections. And I also think when it comes to suicide prevention, I think we have to look at how systems that are set up and understood as helping systems are still putting people at a greater risk. I think about the points made by Kathy and Hunter about clinicians or people who are you go to and you trust as helpers. I mean, they have to do suicide risk assessments, usually as part of an intake or part of a crisis assessment or something. And so you have somebody who's terrified of the answers they might hear, asking an extremely hurting and vulnerable person really sensitive questions. And the only tool they may think they have in their toolbox is to get that person off to the hospital, which is, I mean, we're putting people at greater risk when we set people up like that. And we're setting up not only the person who's hurting, but we're setting up the clinician in that position too. And so I think we think a lot about risk assessments of individuals, but I think we need to do risk assessments of systems and providers and communities. And, you know, it's because suicide is not this kernel of risk that sits inside a person. It's this connected thing between that person and their environment and all the sort of things that they interact with. And so I think sometimes flipping that risk assessment idea on its head could be really helpful to the field. And then when it comes to postvention, again, such good ideas shared already. So I guess the one thing I would add to it would be around data collection. We do a decent job, right, of how old were they, what season was it, what was the means, where were they, but we don't get a lot of great information about, did they have a job? Did they like their job? When was the last time they talked to someone that they loved? How did they stay in touch with people who meant something to them? And that does take resources to do. So I will join the cry of we need more resources to make it happen. But I think learning from people who have been lost, and then also learning from attempt survivors, I feel like we should find a better way of collecting data of you're still here. You're still here. What can we learn from that? So that would be my postvention plug, would be around data collection.
Data collection is so important, and that's been one of my frustrating pieces for years and years and years, is that, you know, in many states that they're just collecting the basic data. Like you said, they're not looking into the most multifaceted information that we could get that's going to create real change. Right now, we're looking at data from 2019. You know, that is the validated data from the CDC, but we're not actually, you know, there's no reason why we can't have real-time data to actually do more, a thorough kind of investigation / report on why people are actually dying by suicide. Age and gender are, you know, obviously essential pieces of information, but also what's the reason why they're dying? What can we do better? Not only for, you know, finding out those pieces of information, but also, and while we're talking to the family to find this information, also listening to the family and how we can help them as well. So this is a, you know, as Hunter said, it's a multifaceted process. But we can do so much more. There are lots of great resources and people use those resources. But I think the one essential piece that, as you said, Anna, is that, you know, we can ask those questions in the clinical side as far as, you know, are you considering suicide? Are you having thoughts of suicide? And then it's like, okay, quickly pass them over to somewhere else when we're not even listening to why they're having thoughts of suicide, which is the essential piece. We want them, if they're thinking about suicide, just in the fact that they admit it, they're going a little bit down, but then it depends on the reaction of the person that's asking them. It's not just shuffling them off to, you know, oh, we got to send you somewhere else. We can't handle this. When the essential fact is that if we listen to their story, it's going to be able to help them better connect with the resource that they are being sent to. So amazing, amazing thoughts by all of you. So the last question is, so we do have volunteers that want to reach out and help, but what would you tell somebody who wants to be an advocate, who wants to be a volunteer to help other people? To how are they going to get involved? What can they do? And you know, what advice would you give them in the starting out and being an advocate? Kathy, what do you think?
I really believe in mentorship. and finding out in your community, are there any people involved in suicide prevention? Introducing yourself to them, making time, but also with the internet, there are so many webinars that educate yourself. It's easy to lose your credibility if you just give an opinion and not back it up. But definitely, once again, you don't have to be in the field. You don't have to have a clinical background. I'm not a loss survivor. And I know that people wonder that a lot and they're afraid to ask me. I'm not a loss survivor. It's because of loss survivors that I do this, but I'm not a loss survivor. But if you are a loss survivor, I can't tell you how valuable your voice is. And just, I keep thinking, educate yourself and make those connections. As a nonprofit organization, and we are so fortunate in that we have funds, and it's only through donations that we do the work we do. We don't get paid, but we could pay for a therapist to go to a conference. We could, and it's not always a suicide prevention conference. We paid for someone who's a wonderful therapist, psychologist on eating disorders to go to their conference, it's very costly because they had a couple workshops on suicide prevention and eating disorders. And so just have an interest. I would say that's your biggest strength, is have an interest and talk to people. And that's how you get connected. Once again, networking and relationships are really where it's at. That's my best advice.
Thanks, Kathy. Hunter, what do you think?
If you have passion for this, run with it. I think that's the biggest thing. I think we need all hands on deck right now, because we don't have, like we've all said, we don't always have the people, we don't always have the volunteers, we don't always have the voices that we need. Don't apologize. That's another one. I think it's hard to be in suicide prevention because we want to be progressive and we want to change the way that we're doing the work. And a lot of times people aren't ready for that. So we tend to temper our approach, or we tend to hold back a little bit. And I want you to know, as an advocate, that's something that you just shouldn't do. Really break down every door that you can. If someone gives you an invitation to be there, you open it up, you start the conversation. Don't be afraid to say something in a meeting that you feel like there's people who are smarter or who have more experience, whatever it is. You say your thought, you say your feeling, especially if you have lived experience. If you have lived experience, I can guarantee you that is just as valuable as the experience of anyone else in that room. And you have to understand that, and they need that experience. So as an advocate, I ask you to open up everything that you are willing to share and give it to the people around you so that they can understand, they can learn, and they can gain from your experience as well. And then don't apologize. Be progressive. Try and change the status quo. This is what we need to do. The more people that we have shaking the tree, eventually something is going to fall out. So that's what we need to be able to do, is just, think of it as like amassing as many people to just change a horribly traumatic social epidemic that's happening in our country, the public health issue, and we need all hands on deck. So as an advocate, don't apologize. Share and use your experience just as anyone else would use their experience, and know that you are as valuable as this person that's sitting next to you in that same meeting, and you are needed there just as much as anyone else.
Couldn't have said that better. Mary.
Well, and I think since we're all advocates here, we think about how did we get to where we're at? I know I didn't have any team to go to talk to, but now we have such a wealth of resources now. Like Kathy said, do some research. If you're in my 2 counties, all you gotta do is Google suicide prevention team. My team's going to come up. And come to our meetings, sit and, observe, ask questions, be that voice. I love it when new people come to my team because I want to draw them in. I want them to see what we're doing. Are you interested in being an advocate? Here's what we do. What can you do? Don't be afraid to talk about suicide prevention or suicide itself, because that's the problem. We don't have enough people out there that are willing to talk about suicide. But find people like us, talk to us, ask us questions. How did you do it? Where did you go? Get as much information as you can. There's conferences, there's trainings, become a trainer. There's QPR, there's SAVE, there's ASSIST. There's lots of trainings out there for you to, build up that knowledge about suicide prevention. Don't be afraid to ask questions. I love it when survivors come to my groups because they are the people we want to hear from, and the temp survivors, because we gain such knowledge. And it's like, you guys help us. What can we do to help individuals in the same situations you are? Because that's where we need to go. We need more people to become advocates. I'm more than happy to talk to someone new that comes to my team. And, sometimes I'm afraid that I might burn them out. Like, can you help us with this? Or can you help us with that? And we have a walk coming up. Can you help us volunteer? That's a good start. Volunteer at something like a walk and get a feel for what's going on and how people make those connections. So, everything's out there that you need. You just got to reach out, make the connections and move forward. Hey, I'm sure every one of us would be happy to talk to someone who wants to become an advocate.
Thanks, Mary. Anna, what do you think?
I think such good advice so far. And I would just say, keep in mind that this advocacy work absolutely can be a part of healing and self-care and empowerment, but it can't be the whole thing, because what makes advocacy work so impactful is coming to it with the vulnerability of what resonates about this with you. And there are going to be days where you can use that and it feels good to use that and it feels good to share it. And there are other days where it's going to feel tender and it's going to feel a little raw, and you have to know what you're going to do about that. I think about doing trainings, and there are days when I can talk about pregnancy loss. I can talk about a family member and what they've been through. And there are other days where I can't. And so I think knowing that advocacy, much like so many other things in our life, it has tides, it has ebbs and flows. You have a support team, have like-minded advocates that you can go to. You can do incredible work and change incredible things and be so proud of yourself. And then the next day you might get checked on your biases and realize that you were telling a story from your perspective, and that's fine, but it wasn't somebody else's experience. And so you have to learn from it. And it's hard, but it's incredible. And if you go into it with this open mind of, my story matters, my voice matters, I'm also going to learn, I think it can be an incredible thing.
Thanks, Anna. I'm just amazed by all of you. And I'm inspired by all of you. And I'm so glad that I can personally call all of you my friends. So, so thank you from the bottom of my heart for being here today. So before we leave, can you just tell us if somebody wants to get a hold of, one of you, and I will put that information actually on our Facebook page and our YouTube page. Can you tell us how someone can get a hold of you? Anna, why don't you go?
If email is accessible, that's probably the easiest way. And so my email is atrout@montcopa.org.
Thanks, Anna. Hunter.
Yeah, email is probably the best way for me as well. And it's just hunter.robbins@phila.gov. Also, if you can find me in any other way, if you can find my cell phone by searching online, or if you can find my LinkedIn, feel free to reach me that way. I'm happy to accept correspondence in any way you can get to hold of me.
Great. Kathy?
This is a little difficult because it's hard to remember, but it's email is absolutely the best, and it's NSPI, and that stands for Northeast Suicide Prevention Initiative. So it's NSPI information, and that's all one word with 2 I's in it, at gmail.com. We were going to go with NSPI@gmail.com, but it was already used. I think a pool company in England had it.
Oh,
So NSPI information, we have a Facebook page, we have a website, but the Facebook page is probably the easiest. So if you don't remember the email, go to Facebook, Northeast Suicide Prevention Initiative, and just message us.
great. And Mary?
Absolutely agree. Email is probably the easiest, and mine is fairly simple too. It's mbrown, BROWN, at ccc-j.com.
Great. And I will post all those emails and everybody's name on our Facebook page and YouTube page. And so thank you again. And I want to close with one of my favorite things. I say at the close of every training that I do, which I really think comes into play right now, is no one can do everything, but everybody can do something. And if everybody does something, then together we can change the world. And I can honestly say that our 4 guests today have changed the world. And they do so much good work. And I learn from them every time I talk to them. And they are an inspiration. And I know that, you know, if I need to throw around an idea, if I need to vent, because yes, we do get frustrated with the obstacles that are in the way, that I can go to each one of them and they could calm me down and say, we can do this together. And that's what it's really about. It's working together to make sure that we are making a difference in saving lives and helping others and making a difference in suicide prevention advocacy. So to my wonderful guests, thank you. I really appreciate you being here today. And every time I think that, you know, if in the start of these first few webinars, you can't top, we topped it. So, and I know a lot of people can learn from what you do every day. So thank you again for being here, and we will talk soon. Love you guys. Thank you.
Thank you.
Thanks for having us.
Oh, and by the way, does anybody have any questions before we go? Jennifer, Anastasia, do you have any questions? Sorry about that.
No, and I'm sorry I jumped on late. I had a doctor's appointment, but I was able to get the 45 minutes, and I just have to say thank you all, and I have to agree and echo all the points made. What dedication and focus, and I believe Anna, I'd like to connect with you more, because I'm actually with the Einstein Healthcare Network, and I do believe that everything touches this in some way or fashion, and we need to make sure that we're looking at healthcare equitably so that we have a better trajectory also on these outcomes for behavioral mental health. So thank you. And I know Govan and I have to talk anyway about an upcoming fundraiser we're going to be having to have resources be brought into our fabulous organization. But I just want to say thank you. This was truly, truly informative. Hunter, I love your passion. And I believe it was Kathy who said she's often frustrated. I think we all are, but the more we stay focused and dedicated, frustration is a good thing, I say, because it keeps us motivated and keep going back for the ask, because it's always no until you ask. And even if it's no, I keep saying you're going to keep.
Thanks, Anastasia. You were getting cut off, I think, but I think, yeah. Oh, thank you for the work that you do as well. For those who don't know, Anastasia is on our board of directors. Jennifer, if you want to say what you actually wrote, or I can just read it, but I'll let that up to you if you want to come on. She's not coming off mute, so I will read you what she said. So she is absolutely mind blown, and you're also inspiring and so passionate. Couldn't agree more. So thanks, Jennifer, for coming aboard today. And hopefully for all of you who do watch us on the aftermath, please reach out. You can also reach out to any one of these people here. And if you want information from Suicide Prevention Alliance, please go to info@suicidepreventionalliance.org. So thank you again. Love you all. Talk to you soon. Thank you.
Thanks, Govan.
All right. Bye-bye.